السلام عليكم ورحمة الله. هنشرح شابتر الأوكيولار تيومرز. أنا الدكتور فوشان، يشرفني ويسعدني إني أشرحه لكم. أوكيولار تيومرز عندي برايمري تيومرز وسكندري أوربيتال ميتاستاسيس. هنتكلم على البرايمري تيومرز. في عندي انترا أوكيولار تيومرز داخل العين، الآي بول، and extraocular tumors outside the eyeball. The intraocular tumors in children, retinoblastoma; in adults, choroidal melanoma. The extraocular tumors أي التيومرز خارج العين. The eyelid, basal cell carcinoma, conjunctiva squamous cell carcinoma, lacrimal gland mixed cell tumor, and optic nerve glioma and meningioma. أما secondary orbital metastases, the most common in children are leukemia, neuroblastoma of suprarenal gland. أما in adults, lymphomas, breast cancer in females, and lung cancer in males. اللي هناخد بالتفصيل الانتراocular tumors, retinoblastoma in children and choroidal melanoma in adults. هنبدأ بالريتينوبلاستوما. Definition: the most common primary malignant intraocular tumor in children of age less than 3 years. Origin: undifferentiated retinoblast of nuclear layer of retina. Clinical picture: symptoms: leukocoria or amaurotic cat pupil, means white pupil. It's present in 60% of cases in retinoblastoma. It is due to malignant cells in vitreous or exudative retinal detachment, or squint in 20% of cases due to involved macula by tumor, leads to amblyopia and squint. Ophthalmos means increase of intraocular pressure, يعني glaucoma in children. It is secondary glaucoma. Symptoms: 4. uveitis due to masquerade syndrome. 5. Orbital cellulitis and proptosis due to orbital spread by tumor. Signs: fundus examination reveals intraretinal tumor. It is dome-shaped white mass with few blood vessels and calcification. Or endophyton tumor. This is due to the tumor arise from the inner nuclear layer of the retina. It shows white mass projecting into the vitreous. Exophyton tumor arise from the outer nuclear layer of retina. Its shape is multilobular white mass with overlying retinal detachment. Secondary glaucoma. It is due to decrease of aqueous drainage by lens iris pushed forward by the tumor, leads angle closure, decrease the aqueous drainage. Or due to increase of episcleral venous pressure due to compressed vortex veins by tumor. Or obstructed trabecular meshwork by malignant cells. Spread of tumor: direct spread or blood metastasis. The direct spread, it is more common than blood metastasis. The direct spread through retina penetrate choroid penetrate the sclera to be in orbit. Proliferation of malignant cells in orbit push the eyeball forward, leading to axial proptose. Or the tumor in retina spread through the optic nerve to CNS. The blood metastasis to liver, lungs, and bones. Investigations of retinoblastoma by number 1, fundus examination, number 2, ultrasonography, number 3, X-ray appears a secondary calcification, number 4, CT scan and MRI appear metastasis, number 5, CSF sample and examination reveal malignant cells. This means CNS spread. Treatment of retinoblastoma. It depends on the tumor size. If it is small tumor, means less than 4 mm in diameter. If the tumor is central, يعني في السنتر of the retina، يعني near الفوفيا، في هذه الحالة علاجه diode transpupillary thermotherapy. If it is paracentral، يعني between الماكيولا والperiphery of the retina، argon laser photocoagulation. If it is peripheral, means في anterior part of the retina, treatment is transscleral cryotherapy، يعني freezing through the sclera. If the tumor size is medium, means less than 12 mm in diameter, the treatment is brachytherapy. It is radioactive plaque، قرص مشع بنخيطه فوق السكليرا فوق التيومر. If it is large tumor but no extraocular spread، يعني التيومر inside the eye not outside the eye, the treatment is enucleation with long stump of optic nerve. يعني enucleation means surgical removal of the eyeball with long stump of optic nerve. بشيل أكبر جزء ممكن من مع eyeball من optic nerve عشان if optic nerve is involved by tumor. Evisceration. What the meaning of evisceration? Empty surgical removal of the content of the eyeball، يعني بسيبها على السكليرا فقط، is contraindicated to avoid blood metastasis. Number 2, if there is orbital spread but no blood metastasis, the treatment is excentration and radiotherapy. What the meaning of excentration? Surgical removal of orbital content and leads. يعني ايه surgical removal of orbital content؟ يعني بشيل الايبول، extra muscles, blood vessels, fat, and the orbital periosteum. If there is blood metastasis، يبقى في هذه الحالة التريتمنت is chemotherapy. Differential diagnosis of leukocoria in infants. يعني لو جالي infant فيه white pupil، في هذه الحالة قد يكون due to congenital cataract. Number 2, retrolental cyclitic membrane due to iridocyclitis، يعني في inflammation of the uveal tract. Or persistent hyperplastic primary vitreous, it is congenital anomaly in vitreous. Number 4, vitreous abscess due to infection of endophthalmitis or panophthalmitis. Toxoplasmosis or toxocariasis infection, retinal dysplasia, congenital anomaly of the retina, retinopathy of prematurity, or retinoblastoma or Coats disease. Coats disease, it is due to abnormal leakage from retinal blood vessels, leakage of lipids. The second important intraocular tumor is choroidal melanoma. Definition: it is the most common primary malignant intraocular tumor in adults of age around 50 years. Incidence: negative family history, rare in black races. Origin: arise from melanocytes of uvea. Commonly choroid, بتبقى about 80% of cases. Clinical picture: symptoms asymptomatic, or the patient is complaining from diminution of vision due to involved macula or secondary glaucoma or malignant exudative retinal detachment. Signs of choroidal melanoma: fundus، هلاقي في عندي unilateral subretinal elevated brown mass vascularized and mottled with yellow lipofuscin pigment, and it is usually near the optic disc. Or exudative retinal detachment. Number 2, secondary glaucoma. The causes same as in retinoblastoma. Or spread of tumor. Spread of tumor, direct or blood metastasis. The direct spread of the tumor penetrate a prox membrane and retinal pigment epithelium, leads to subretinal collar stud tumor. Or pass through scleral channels of anterociliary blood vessels, reach to ciliary body, leads epipulbar mass. Or spread through posterociliary blood vessels، يوصل للأوربت يعمل لي بروبتوز. Or through blood metastasis reach to liver, lungs and bones. Investigations of choroidal melanoma by number 1 fundus examination. number 2 ultrasound، الاقي في عندي choroidal excavation and orbital shadow. number 3 CT scan and MRI، ممكن الاقي metastasis. number 4 positive uptake of radioactive phosphorus by malignant cells. Treatment of choroidal melanoma: it depends on the size of the tumor. If it is a small tumor and it's located posterior near the fovea or optic disc, treatment diode transpupillary thermotherapy or by external beam of protons radiotherapy. If the tumor is small and peripheral، يعني anterior للإكواتور، يعني في الجزء الأمامي للعين، treatment is brachytherapy or transscleral local resection of tumor with underlying scleral flap. If it is large tumor and confined inside the eye، يعني مفيش extraocular spread، في هذه الحالة هعمل inoculation. But if there is orbital spread but no metastasis، يبقى هعمل excenteration. If there is metastasis، يبقى treatment is chemotherapy. Differential diagnosis of choroidal melanoma: choroidal mass nevus، حسنة على الكرويد، هلاقيها small, not elevated, not vascularized and no lipofuscin pigment، عشان أفرقها ما بينها وما بين الكرويدال melanoma. number 2 hemangioma can be differentiated by ultrasonography. Inflammatory granuloma or choroidal metastasis, and it is usually bilateral, but in choroidal melanoma it is usually unilateral. The number 2 retinal detachment. شكرا جزيلا.